Do you know what foods can help manage diabetes? Or which ones can potentially worsen your condition? If not, don't worry, this video is here to guide you. Let's kick things off by understanding diabetes. It's a chronic condition that occurs when the levels of glucose or sugar in your blood are too high. It comes in two main types. Type 1, where your body doesn't produce insulin, and type 2, where your body doesn't use insulin properly. Now you might be asking, why are we talking about food? Well, because your diet plays a critical role in managing this condition. Monitoring your carbohydrate intake, including lean proteins, incorporating healthy fats, aiming for a high-fiber diet, and paying attention to portion sizes can help control your blood sugar levels. Managing diabetes isn't just about medication, your diet plays a crucial role too. So let's delve deeper into the foods you should eat and avoid to manage diabetes effectively. Let's delve into the types of foods that can help manage your diabetes. First up, carbohydrates. These are key players in your diet, but you should keep an eye on what type you're consuming. Opt for complex carbohydrates like whole grains, fruits, veggies, and legumes. They're digested at a slower pace, causing a gentler rise in blood sugar than their refined counterparts such as white bread and sugary snacks. Next, we have proteins, including lean protein sources like poultry, fish, tofu, beans, and nuts in your meals can help stabilize blood sugar levels and keep you satisfied for longer. Remember, a balanced diet is a healthy diet. Now let's talk about fats. But not just any fat, we're talking about the healthy ones. Avocados, nuts, seeds, and olive oil are excellent sources of these. They can help enhance insulin sensitivity and promote a healthy heart, so don't shy away from adding these to your plate. Fiber, an often overlooked but essential part of the diet, is up next. A high-fiber diet, including plenty of fruits, vegetables, whole grains, and legumes, can help control blood sugar levels and improve your digestion. It's like a natural regulator for your body. Last, but by no means least, portion control. It's not just about what you eat, but how much you eat. Overeating can lead to spikes in blood sugar levels, so pay attention to your portion sizes. Now that we've covered what to eat, let's quickly touch on what to avoid or limit. Sugary foods and beverages, processed carbohydrates, saturated and trans fats, high-sodium foods, and alcohol can all interfere with diabetes management. They might taste good, but they're not doing your body any favors. Remember, everyone is different, and what works for one person might not work for another. It's crucial to work with a healthcare professional or dietitian to develop a personalized meal plan that meets your individual needs and helps manage your diabetes effectively. Incorporating these foods into your diet can help stabilize your blood sugar levels and overall health. Just as there are foods that can help manage diabetes, there are also foods that can potentially worsen your condition. It's crucial to understand what these are so you can make informed decisions about your diet. First, let's talk about sugary foods and beverages. These sweet temptations can cause rapid spikes in your blood sugar levels. So it's wise to limit your intake of sweets, sugary drinks, and desserts. Next up are processed carbohydrates. Foods made with refined grains such as white bread, white rice, and sugary cereals are best avoided or limited. These foods tend to be low in fiber and high in carbs, which can lead to increased blood glucose levels. Moving on to fats, particularly saturated and trans fats. Foods high in these fats, like fried foods, fatty cuts of meat, and processed snacks, should be eaten sparingly. They can increase your risk of heart disease, a common complication of diabetes. Sodium is another culprit. High sodium foods can elevate the risk of high blood pressure and heart disease. Be cautious with canned soups, processed meats, and salty snacks. Lastly, alcohol. While it may not directly impact your blood sugar levels, it can interfere with diabetes medication and lead to other health issues. So it's best to limit your consumption. Remember, avoiding these foods can help prevent sudden spikes in your blood sugar levels and other health complications. So choose wisely and take control of your health. To wrap things up, managing diabetes involves careful dietary choices. Keep a close eye on your carbohydrate intake, incorporate lean proteins, healthy fats, and a high-fiber diet into your meals. Be mindful of portion sizes. Limit consumption of sugary foods, processed carbs, saturated and trans fats, sodium, and alcohol. But remember, these are general guidelines. Every individual is unique. So work with a healthcare professional to create a meal plan that suits your needs. Together, you can effectively manage your diabetes.